Merry Christmas and a Happy New Year dahil ngayon ay holiday season at alam yung napanood po ninyo yung part 1 ay holiday season healthy lifestyle kung saan kasama natin si Dr. Josetan. Ngayon dito sa part 2 ng webinar po ng St. Stephen High School Alumni Association ay tungkol naman po sa booster shot, anti-vaccine. Dahil marami nagtatanong sa akin o marami naguguluhan. Ano po ba ang kinakailangan pa rin po ba magpa-booster shot? O pwede na yung first and second dose? O kaya naman, ano po ba ang pwede po ba maghalo? Let's say, kunwari, ang kanilang first and second dose ay Sinovac. Pwede po ba ang booster po nila ay sabihin natin Pfizer, Moderna o AstraZeneca, yung mga katanungan na sabi ko, yun ang magiging topic natin, which is sinagot ni Dr. Jose Tan ang lahat ng mga tanong namin. Si Dr. Jose Tan ay isang internal medicine at gastroenterologist, pero dahil po sa marami po siyang mga na-encounter po ng mga pasyente na admit po sa Chinese General Hospital and Medical Center, pati na rin po dito sa Metropolitan Medical Center. So, kaya siya ay talagang nagpapayo na kailangan talaga habang marami pa tayong vaccine ngayon, magpaturok na po kayo. At sa mga katanungan na nabanggit ko kanina, malalaman po ninyo yung kasagutan. Panoorin po ninyo itong aming webinar webinar po ng St. Stephen High School Alumni Association. Ito po ay ginanap po noong December 4, 2021. Kasama ko po ang partner ko na si Jerry Nang. Kaya panoorin po ninyo at I'm sure mas magugustuhan po ninyo. Siguro lahat ng mga katanungan po ninyo tungkol po sa booster shot, dito po ninyo malalaman ang kasagutan. O kaya naman, tinatanong, hindi kayo makapag-decide, dito siguro after nun yung panoorin aming webinar, kumbaga masasagot na yung katanungan na o yung kumbaga yung doubt na hindi mo alam kung anong dapat piliin, nandito na po. Panoorin po ninyo ang webinar with Dr. Jose A. Tadpot. And then, nandito na po tayo sa ating part 2. Ito po ay tungkol po sa booster shot. Baka kasama pa rin natin si Dr. Josetan. Dahil dito ngayon sa Pilipinas, umabot na sa kabuuan 7.3 million Pilipino na ang kumbaga napakunahan na sa 3 araw na isinagawa ng National Vaccination Day yung mula November 29 hanggang December 2. Kaya naman umabot na sa 37.57 million na ang nakatanggap ng kumpletong dalawang bakuna o katumbas ng 34.9% ng populasyon, habang nasa 52.63 million naman ang first dose o katumbas ng 47.6% ng populasyon. Ayon sa DOH o Department of Health, nasa 67.17 na ang populasyon ng bansa ang nabakunahan na, kaya malapit na nating makuha ang herd immunity na 70%. Pero dahil sa bantad na rin ng panibagong Omicron variant, ipinag-utosan ng DOH ang pagkakaroon ng booster shot sa mga adult Filipinos na nabakunahan na at least 3 months sa mga nakpaturok ng Janssen at 6 months sa mga nakbakuna ng Sinovac, AstraZeneca, Pfizer, Moderna at Gamaleya Sputnik. Kaya ngayon gabi at makakasama at si Dr. Joseta na naman na mag-i-explain ano po ba dapat ang pipiliin natin, dahil 'di ba ang sabi ng DOH meron dalawa ang tinatawag natin ngayon, homolog isang hetero at isang homologous. Ibig sabihin at pwede kapag ang first and second dose mo ay Sinovac, ang dapat third dose mo ay Sinovac. Let's say kung yung first and second dose ay Pfizer, third it should be Pfizer. So ngayon nagugulan ang mga tao, ano ba talaga ang pipiliin nila? Kasi sabi nila Dr. Josetan, kapag ang pangatlo ay the same brand, ang tawag daw doon ay third dose, hindi daw yung booster shot. So Doktor, pwede po ba paki-explain para, kasi sa ngayon I think marami pa naman na hindi pa umaabot ng 6 months. So naguguluhan pa sila, at para maano natin sila, mag-guide natin sila which brand po ba talaga ang dapat? Dapat po ba same brand o different brand, Dr. Josetan? At for me, let's say if kung you're planning to go abroad, for me, one of the siguro yung pagde-decide which brand, let's say kunwari, yung first and second dose mo is Sinovac. And then you're planning to go to Canada. So then after yung first and second dose, sabi natin 6 months after. So if you're going to Canada, dapat ang pipiliin ninyo is Pfizer o Moderna. Or else, kung hindi, pagpunta po ninyo doon, I'm not sure kung hindi kayo papasukin or mapipilitan po kayo magpa-jab naman na, magpapaturok again. So, yan ang mahirap kapag yun is one of the decision making. Kung hindi kayo alis ng bansa, ito ang topic natin. At kung dapat po ba i-Decemberan. Kasi sa ngayon, meron naman mga pasyente, yung mga may comorbidities, maraming doktor naman ang sinasuggest ay ang paggamit ng Moderna at iba Pfizer. So ngayon, siyempre mas maganda, manggagaling kay Josetan. And then another thing, at ang mas may pinapayo na naman, na bago tayo magpa third dose, o sabihin natin kung kayo po ba ay tinamaan ng COVID. So kapag tinamaan ng COVID, ang sinasabi, mas tumataas ang antibody, which is mas maganda na tinatawag nila CPAS to check kung mataas po ba iyong antibody. O kung pwede na ba tayong magpa-second dose o pwede i-delay natin. So yan ang mga topic na dapat natin malaman at alamin natin kay Dr. Josetan bago tayo magdesisyon. So yung yan ang mga dapat natin malaman. Kasi ngayon, yesterday, nag-start na ang IATF o DOH, allowed na po ngayon yung mga adult natin, yung mga 18 years old and above, na pwede na po kayo magpa-third dose. And then yung sa mga bata naman, since ang approved lamang sa mga bata is only Pfizer, 12 to 17 years old, Pfizer lang ang allowed sa ngayon. Ang Sinovac hindi pa po pwede sa mga below 18 years old. So ngayon, kasi karamihan gusto pa rin Sinovac o Sinovac ang tawag, which is ito ay magandang pag-usapan dahil yung iba naman yung iba naman yung nakaroon ng first and second dose, ayaw na nila magpa-third dose, ayaw na po nila magpa-booster. So ang tanong, di ba meron na naman bagong virus, itong Omicron. Ito po ba ay...
Oh my God.
Di ba itong Omicron, ito po ba kung first and second dose, masasabi na ba natin na safe na ba tayo dito sa virus na to? Kasi based sa last week, ang Omicron ay 10 times ang lakas niya, 10 times mas nakakahawa transmissible compared to Delta. And then nung panahon ng Delta naman, ang karamihan, 80% ang mga tinamaan ay mostly unvaccinated. So ngayon, halos marami na mga vaccinated, karamihan ay mga first and second dose tapos na. Pero sino naman ngayon at risk, which is kausap ko ang National Children's Hospital and then PGH. Ngayon ang kinatatakutan ngayon, yung mga bata ngayon. Ano ang doktor sa ngayon, di ba sabi ng DOH, pwede homologous which is same brand or heterologous yung different brand o mixing ng brand. So for you, lalo na sa ating mga senior, dito sa mga alumni, na yun ang tinatanong nila, ano ang mas pipiliin nila, same brand o mix?
Okay, meron yan recommendation ng DOH, no? So, one is that for Sinovac, if you have pre-Sinovac, no, then this depends on your study. Now, there are 2 studies, one from the Chile study, and then the other one is from the China study. China study, after giving the 2 doses of vaccine, the antibody level, China study used antibody level. The Chilean study used effectivity, yung infection level. China study says that after 2 doses, medyo bumababa na ang antibody level. When you give the injection on the 3rd dose, 6 months after, increased by 130-fold. Naging 130 times more ang kanilang antibody. Okay? Which is expected at booster. But yung Chilean study, they use effectivity by preventing infection. So when you have Sinovac, the effectiveness was, sana may slides tayo, no? So from 50% effectiveness, if you give third dose of Sinovac, it will go to 70%. Okay? So yun ang effectiveness. Effectiveness is that hindi ka makakasakit. You will not get sick. Okay? Then the other one is that when you give 2 doses of Sinovac and then followed by Pfizer, it will go to 93%. Okay? Then when you take Astra, it will go to 90.3%. Effectiveness yan. Ibig sabihin, mas hindi ka magkaka-infection. But based on the effectiveness of Sinovac from 50% to 70%, that is good enough. Okay? Ngayon, the antibody level nag-triple. Okay, from naging 138 times higher than the, no. So that is the study from Beijing. Ang tanong mo, ano ang mas maganda? So, do we use Sinovac? Do we use Pfizer? Do we use Astra? Okay. The answer here is, if you are allergy o marami kang mga comorbid, mataas ang chance mo na magkaroon ng allergy o masyado kang very, very sensitive, then I would advise you go for Sinovac. Okay? So, yun, para walang tema. So, majority ng mga senior citizen chose the Sinovac kasi takot sila magkaroon ng reaction. While if you have no allergy, you don't have any reaction to this COVID, still, Pfizer will be a better choice. Okay? Kaya lang, Pfizer, maraming, I myself, I took 2 Sinovac and 1 Pfizer. Ang booster ko, Pfizer. So what the Pfizer? Pfizer, they use 30 nanogram, no? 30 nanogram of this vaccine as compared to Moderna, which they use 100 nanogram. So it is 3 times, no, the dose of the Pfizer. Ayun, tingnan mo lang kung saan. Mas marami ang side effect ng Pfizer kesa sa Sinovac. Pero mas marami ang side effect ng Moderna kesa sa Pfizer. So, yun ang ano. Kaya, ngayon, kung ang pasyente wala masyadong symptoms, wala masyadong allergy reaction, then I will go for a Pfizer. Pero kung very sensitive, kasi may pain mga 2 to 3 days pain na. Tapos medyo, yung iba nagkaroon ng konting lagnat, yung iba naman nagkaroon ng konting trangkaso. But not as severe as yung sa nakita ko sa mga nagpa-booster na Moderna. Talagang maglalagnat, chichills, yung iba 2 days hindi pumasok. So mas malakas. Ngayon, they found out that the Moderna has to be given only half of the dose. Instead na 100 nanogram, they are now giving 50%. So, mas mababa na yung side effect nila sa ngayon. Ngayon, there is some alarming story about the Moderna in Europe na nagkaroon ng konting side effects sa myocarditis, especially for the young male below 30 years old. Young male below 30 years old. So these people develop myocarditis. It is an inflammation of the heart. Okay? Yun lang. Medyo mas marami. That's why the European country, some of them stopped using it. No? But still, we are waiting for the update. No? But the one I was able to get is that medyo may konting problema dito sa ano. So yung sa Europe, like in Iceland, ano, pero some of them resume using Moderna, but with a lower dose na. So yun ang ano.
Doctor, kung ano naman, di ba, itong nakaraan, yung March and then August, marami yung mga yung iba naka first dose lamang, yung iba naka second dose, pero tinamaan pa rin ng COVID-19. And then, so, di ba, pag sinabi kapag tinamaan, meron na silang natural immunity, and then, plus the 2 doses, ibig sabihin, mas, kumbaga mataas na raw ang kanila antibody, kailangan pa rin po ba nila magpa-booster shot?
Okay, that is a good question, no? So, when people ask me, according to the DOH, wala pa silang wala clear guidelines on this na mga naka-COVID na nung kung pwede, no? But ang kanilang ruling is that yung mga hindi pa nakakaroon ng vaccination, once naka-COVID sila, after a week or two, you can go for the vaccination. Yung mga hindi pa vaccinated. Pero those who were vaccinated and then develop COVID, okay? So do they need to learn? So I'm a very inquisitive person, no? So I will just tell them, sige. So ginawa ko, pina-antibody test ko. So anong look? So yung isang pasyente ko, 2 weeks after the, 2 weeks after the COVID, no? Then he told me they would like to have a booster dose. So what happened is that I said, okay, you have to do antibody test. Now, just give you an update, no, regarding the COVID before we proceed with the question and answer. So this is the report from PGH, no, no new COVID admission for the last 2 days. And this is reflected in the whole country. Like here in Chinese Gen, we have 1 or 2 patients a day admission. And our ward, siguro, less than 20 na lang ang pasyente namin sa COVID ward. Now, if you look at it, no, so they have 0 admission, no? And then currently admitted 63. This is for from a high of 250 to 300. Okay, so talaga mababa na. Today's COVID is 500 na lang tayo from a high of 26,000. So that's a good news for everybody. Now, itong mamaya natin sasabihin to. Tapos, vaccination, as I said, so we have single day job. 2% sa Pilipinas, no? We are ranked number 4, no? US, from India, US, no? And then also, ito sinasabi ko, no? From effectiveness, this is from 2.9 million vaccinated Chilean real-world study. Effectivity, China, Sinovac, 50.13, no? While percent, if you add an additional third dose, it became 70.8. Now, in Sinovac plus Pfizer, 93%. 2 Sinovac plus Astra, 90.5%. Now, this is called the real-world study. It is actual. If you get infected, then you are not effective. If you don't get infected, you are effective. No? So, yun ang actual. So, ngayon, Pfizer niya is 14 days lang. 14 days after second dose is 80. Astra is 66. Sinovac is 50. And then, when you add Astra, first dose, Pfizer, second dose, 75. No? So, the WHO meeting says that mixing COVID vaccine as booster is highly effective. Okay? Ayun, itong third dose na to, as of this moment, this is only given for those with high-risk people, no, frontliner, and then immunocompromised. Kasi immunocompromised, body nila, hindi enough. So we have to give a third dose. This is not considered as a booster. Pagka immunocompromised ka.
this is considered as a third dose lang. Okay? So, ito yun. Tapos, ano pa ba dito? Yes. Okay. Maybe we can, anong question natin kanina? Tungkol sa Hilda? About...
Yung regarding yung, di ba, yung sa mixing?
Yes. Okay, mixing. Yeah, mixing. That's why they are as effective as ano. Now, the study of China, Sinovac, it develops 130% increase in the antibody level. Now, your question is, kung nagka-COVID siya, no?
Yun. Kung naka-COVID siya at meron na siya first and second dose, kailangan pa rin ba niya
2
magpa-booster?
doses. Okay. Yes. Correct. Very good question, no? Ako kasi inquisitive mind ako eh. So, what I did is I requested for neutralizing antibody for my last 3 COVID patient. Okay. The first COVID patient has the test done in Cardinal Santos, wherein their antibody level is 500. Above 500, protective ka na. Okay? So he said he would like to have a COVID vaccine after 2 weeks of recovery. I said, theoretically, okay, pero I want to check the antibody. The antibody came in, and it was 2,000 times antibody of the protective. 2,000 times. So I advise him do not do the vaccination. Okay, so that's bad. Okay, so that's your antibody is still very high. So another patient of mine just recovered at 1 month time and go whether they want to do the vaccination. So I have them tested for neutralizing antibody. And then the normal is 0.8. Her antibody was 22,500. That was 3,000 times elevated, more than the antibody for protection. Ano meaning niyan? The meaning is that if you are going to take the context of booster, the booster means the antibody, whatever vaccine you give, Sinovac, Pfizer, Astra, anything, the antibody after 6 months, everybody goes down. Every one of them. Walang exception. So that's why you need a third dose for a booster. And since you had COVID vaccine, COVID infection, COVID is your booster. You get the point? Yung third dose mo yun ng COVID. That's why you want to a booster is because your antibody goes down. But when your antibody is 2,000 times and 80,000 times elevated, you don't need booster. So yun ang aking contention. Okay? So ngayon, meron ngayon na bago pa kasi lumabas itong booster, yung mga self-injection sa Moderna. No? So there are plenty, even mga doctors na pa-injection ng Moderna. No? And you don't know that Moderna is 100 nanogram compared to Pfizer, 30 nanogram lang. So, ngayon, one of my relative took Moderna first dose, and they are going to take the Moderna this week. So she asked me whether they should undergo the second dose. I said, I have no way of knowing how bad is this a situation. So I want to test your antibody. So the husband antibody was 44,000. So you need 500 lang for protection. The antibody of the husband was 44,000. The antibody of the daughter was 44,000. But my patient, my relative, 2,005, which is also almost from 500 to 2005, 5 times elevated. So I said, for me, yung 5 times elevated, pwede pa mag-second dose ng Moderna. Pero I don't think you should undergo. Mataas masyado ang antibody. Ngayon, ano ba ang delikado? Bakit ka natatakot? Maganda rin, mas mataas ang antibody. Because yung antibody, papanik yan, tapos bababa yan. Pag nag-double dose ka, ganun din mangyayari. So, ang pakiramdam ko, and there's a projection that we may need booster every 6 months to every 8 months in the future. Para lang masawata itong. That's why you don't need, how about if I give more booster, what will happen to me? You will develop overdrive of antibody. Overdrive, ibig sabihin, masyado marami. And sometimes, according to the study, that they can develop into autoimmune. Ibig sabihin, yung antibody mo, imbis na patayin ng virus, yung sarili mong cell ang pumapatay na sa sarili. They are killing each other. That is the danger. Because wala pa kasi ang na magbibigay ka ng 2 doses ng all this thing. They are only asking for 1 dose. Now, yung mga gusto magkaroon ng pumunta sa Amerika, pumunta sa Europe. Now, Europe, they have already accepted Sinovac. Okay? So, paayos mo yung certificate yun, accepted na yung Sinovac sa Europe. And according to the WHO, Sinovac is also included in the US sa pwede na vaccinated, accepted. According to the WHO, they are already accrediting the Sinovac. So those who would like to, you don't have to have a double dose of this thing. Just a booster will be enough, no? And then for all you know, we may need this every 6 months para lang masustain, para hindi na pumasok yung mga variant. Okay? So yan lang, yung pag-check ka ng my advice is when you want to do additional booster, mag 2 doses ka ng Pfizer, after 2 doses of Sinovac, check mo ang antibody mo. Pag sobrang taas na, hindi mo kailangan kasi ang purpose mo is to increase the antibody. Your antibody is already 8,000 times, 2,000 times already. What are you going to do with those antibody? Hindi na. So, kung sa ating layman's word, overacting na yan.
Okay. Doktor, ano ba dapat let's say kung magpapalaboratory sila, dapat ba ang pagpapatest sila ng CPAS o yung IgG o dapat dalawa?
You should do the neutralizing antibody.
Neutralizing.
Yeah, neutralizing because it's the one that that they detect yung effect ng vaccination. Okay?
Neutralizing, yun ang tinatawag natin na CPAS.
Yeah, CPAS o Maglente.
Yes.
Yun. Pero mas mahal ata yung Maglente ata. But you just ask when neutralizing. Meron sila kanya-kanya, merong 500 ang cut-off, merong 0.3, kanya-kanya. Each laboratory kanya-kanya. Basta you have to look at the ratio. Kasi siya, tapos ang result 2005, so that is 3,000 times of what you need. So how do you do the ratio? No?
Doctor, like in my case, ang aking CPAS after my second dose, 53.3%, greater than 30%.
Oh, yan, 53, okay. So, protective na yan. Protective na yung CPAS mo. So, but after the booster, papalo yan ng 1,000. After the booster, papalo ng 1,000 yan.
So, kapag ganyan, 53, considered as hindi siya mataas, okay pa magpa-booster?
Yes. Pwede yan. Kasi yung pag nag-booster ka, abot ka ng 1,000. So, after that, huwag ka magsa-second dose na. Kasi sobra na.
Dahil sobra na.
Oh, yung 53 mo, when did you have the test?
Ito ay 2 months after my second dose.
Bababa pa eh. Mas mababa na siya ngayon.
Mas mababa na.
Kasi all Pfizer, Astra, bababa yan. That is the natural course. Magpabula na. Tapos, when you have a booster, the booster will push you 10, 20 times. No? So yun ang booster. Kaya nga the reason why the government don't advise booster is because some of our colleague, no? Ito ata yung some of our colleague, hindi pa sila nagpapabakuna.
Mm.
So, when you look at the people who were admitted in the hospital, 90% of them are unvaccinated. When you look at the people who died in the hospital, 90% of them are unvaccinated. Okay?
Yes.
Sorry, no? Let's say the caregiver of my mother-in-law, she is a caregiver. She said, "Doctor, I have right not to be vaccinated." But she stayed with us. I said, yeah, you have the right. Then she got COVID. Affected my mother-in-law. So both of them na hospital. After she was discharged, since my mother-in-law was given vaccination, she recovered faster. At 17 days, wala na siyang antibody, wala na siyang antigen, o wala na siyang COVID. The caregiver is still positive. And then, when we do the x-ray, wala siyang symptoms, walang symptoms. X-ray, meron siyang pneumonia. So, she has to be admitted for another 10 days. And in remdesivir, all these things. After she recovered, she said to me, I cannot forget, Doctor, gusto ko na magpabaksin. So, dapat ginawa mo yan dati. You should have done that early. Because you let us spend so much money and then my mother-in-law got into serious trouble because of you. You want to exert your right. Tama, gusto mo yung right mo na ayaw mo magpabakuna. Pero hindi mo inisip yung karapatan ng tao na mahahawaan mo. So I told her, so sabi ko, you spend almost $500,000 just because you did not undergo vaccination. Okay? So those people who were not vaccinated, after I discharged them, they underwent vaccination. What is huli na ang pagsisisi? At people are doing the anti-vax. Pag nag-vaccinate ka, magiging zombies ka. No? So, people are afraid. No? People are afraid. So, maraming anti-vax na ganun. So, let's make it
Doktor, what
yes.
if naman, yung mga talaga anti-vaccine, up to now, yung first and second dose, di ayaw talaga nila. And then ngayon, sabi daw nila, since ngayon, halos 70% na, lalo na sa NCR, na mga fully vaccinated na, first and second dose. So sabi niya, may herd immunity na. The more, di ko kailangan magpa-vaccine. Ganun ang reasoning. Ano masasabi mo?
Ang masasabi ko lang sa kanila, kasi pag hindi nila mahal yung sarili nila, mahalin nila yung kapatid nila, yung co-workers, no? As my caregiver, then sabi niya, now I finally realized that I have to be vaccinated. Pero, paano naman ang mga hinawaan ng tao? So those people who were now admitted majority are not vaccinated. And then you look at the USA, no? Meron silang tinatawag na vaccinated, anti-vax na party. Look at the news. So people who were sick, no? Yung iba nasa wheelchair pa. Dinala party para hawaan sila, no? And then what happened? 10 of them were admitted in ICU and some of them died. Those unvaccinated. So this one, kaya lang kung gusto nilang magkasakit, mamatay, wag na sila magdamay ng ibang tao, no? I think Duterte, President Duterte has come up with a rule on the yung mga tao na hindi vaccinated, they were asked to do swab every week, no? Or every week. Because they cannot help na exert the right na ayaw ko mag-vaccinate dahil that is my right. Kami na vaccinated, may right din kami na hindi namin kita gustong makasalamuha. The right also to protect our, no? So you're right. And then you infect us, how about us? We don't have the right, di ba? Ganun yun.
Doktor, how about yun na ayaw magpa-vaccine, pero tuloy-tuloy pa rin ang pag-take nila ng ivermectin?
Oh yes. Yeah, that is ang ivermectin actually, believer din ako ng ivermectin. Kaya lang, once na naka 2 shot na vaccine, majority of we tend to stop using it, no, after we have 2 doses of vaccination. And then those who were na-expose lang, let's say na-expose ako sa COVID na pasyente ko.
Mm-mm.
No, then nag-positive siya, natingnan ko siya, hindi ko alam so I take but not for the long term. So that's for my protection. But if you use the ivermectin for protection, since there is a better drug like vaccination, medyo hindi na masyadong nasa lugar. Pero respect their rights kasi there are plenty of doctors who did not have their vaccination also. But siyempre, kanya-kanyang rights yan. So we just have to respect them.
How
Yes.
about yung how about yung mga magulang na dinadala yung mga bata nila, mga 10 years below, sinasama nila sa mall, sa hotel, sa buffet, and then syempre hindi naka-face mask. Sa tingin po ba, Doc, kapag ka nakaroon ng another surge, yung mga bata ang unang tatamaan?
Yeah. Nangyayari yan sa Amerika, actually ang daming mga bata na tinamaan. That's why they lower down the vaccination. Now they're going down to 5 to 12 na, pwede na
5 to 12, yeah.
years old. So they only give half dose of the sa US. We have the 12 to 17 years. They also give I think half dose lang sa mga pediatric.
Jerry?
Yes.
Sorry.
Yes. Go ahead.
Jerry,
Doc,
doon sa chat box.
okay, may dalawang tanong dito na related. Number 1 is, kunwari, may tanong dito kasi, nakadalawang shot na siya ng Sinovac 6 months ago. Tapos, nagkaroon na siya and then last month, nag-Moderna booster shot na siya. And then, this month, pinapabalik siya for the 4th dose.
Yeah.
So, advisable ba dapat na mag-4th dose pa siya o hindi?
My advice,
hindi dapat?
this is the same with my relative, no? So, yung nagkaroon ng 44,000 na kasi the wife is 2,005 lang ang antibody. 500. So 5 times. Ito hindi pa naka-COVID. Pero yung nag-44,000, yung husband niya at saka yung daughter niya, these are the people who had COVID infection na asymptomatic. Kaya sabihin mo dun sa pasyente mo na magpa-neutralizing antibody siya. And the neutralizing antibody will be about 1,000, 3,000 times more than the required. So, after getting that, and still gusto niya, good luck na lang.
Okay. Okay, kasi dalawang Sinovac at isang Moderna na Okay.
Tapos may COVID pa siya So, tatlo yan. 4 dose na siya Nagka-COVID siya. Dalawang Moderna, dalawang Sinovac. Nagka-COVID siya. Booster na yan. Then, nag-Moderna pa siya.
Aray ko po.
So, that is already 4th dose yan. Overdrive. No?
Overdrive. Opo.
Okay na. So, hindi na logical, no? So, this is emotional na,
related kasi dyan, may tanong kasi din dito sa chat box kasi, meron kasi nung sobrang grabe yung situation nung August, September, ganon, mataas. So, naghintay sila ng 3rd booster shot. Tapos, dahil sa mga irrational fear, media hype, hindi na sila makapaghintay. So, pumunta sila sa Nayong Pilipino at nag-declare na hindi pa sila vaccinated. So as of today, nakadalawang first shot, first and second shot sila dati, and then ngayon, nakadalawang shot ulit, additional 2 shots ulit. Naku po, ano daw pong health risk sa mga taong nagkaroon ng 4 shots already? Hindi sila nagsabi ng totoo So sila sa Nayong Pilipino, nag-declare sila, hindi pa vaccinated. So nakadalawa ulit sila. Although hindi siya nag-declare kung anong pong brands ang inano niya dito sa
Moderna. Moderna yan, Moderna. Kasi
opo.
that it be given by the private yan eh.
Good luck na lang po.
Sa Pfizer kasi, before ako napa-booster ako, they look at your antibody
Opo.
before they give. So Pfizer yan, mahigpit sila eh. Pero your vaccine record. And then there's no private vaccine for the Pfizer. Government. So walang private yan. It's only Moderna that has private. So this is the Moderna. I am not against giving the Moderna. I'm not against it. But the recommendation is half dose lang.
Half dose lang.
So in this na 100 nanogram, you have to give 50 nanogram. That is why yung actually, mga kasama ko sa ospital, siguro mayroong mga 100 sila nagpabakuna ng 2 doses. So, mga doktor na yan eh. Kaya, and as I said, that's your own, kung gusto sila masaya, so walang problema. Pero, if you are going to look at it in a scientific way, the reason why you have booster is because you want to increase your antibody. That is because 6 months after the first 2 doses, the antibody will go down whatever vaccine you use. You have to have a booster. Correct. But the problem is that you have to check your antibody level. If it is so high, what is the use of a booster to increase antibody? 2,000 times na eh. Ano pa gusto mo itaas? Gawin mo 1 million times, no? Hindi na it's not logic, no? So, but people are emotional. They want to go abroad, ganyan. Eh sabi ko, kasi nga ganito yan, private lang naman yan eh. So you can always tell them na, I don't want the second dose, but please give me the, kasi paid na yan eh. These are paid already. So pagbayad mo, you paid 4,000
doses
or 5,000 for 2 doses. They are paid. Pero huwag kang manghinayang sa paid mo kasi your body is more important. But as I said, dito sa hospital namin, siguro more than 100 people na nagpa-2 doses ng Moderna. So we can only see the problem in the future. But Moderna, 30 years old below, wag na. If you are 30 years old below and male, the recommendation from the European country is do not give for moment, wag muna.
Okay. Opo.
Yung other vaccine, pwede pa.
Pero kung doktor, kung more than 30 years old, 1 dose lang. Huwag sila magka-2 dose.
After 1 dose, magpa-antibody ka. Pag mataas na antibody, the purpose of second dose is useless. So, kasi mataas na antibody mo, you're protected by increasing the antibody. And your antibody is not 10 times, 100 times. It is 2,000 times. So, kahit na anong virus na bigay mo dyan, mapapatay nila yan eh. So why do you have to take the 3rd dose? No? Hindi logic. So sometimes we have to use our common sense. Eh. Although wala pa kasi wala pang recommendation, pero if you use your common sense na magpapabooster ka para tumaas ang antibody mo nasa 2,000 times. I'm not talking about 5. Kasi your control, let's say your control is 500. If you go for 5,000, that's 10 times, no? 5 times, 2 times already protected na pag na 2 times ka eh. Let's say 30 Hilda, pag nag-60 ka, protected ka na. And then when nasa 2,000, ano pa gusto mo? So, hindi na masyadong wala nang logic, no common sense na ginagamit. Basta, no? Yan.
Eh doktor, katulad doon, siyempre sa sobrang takot, di ba? Lalo na ngayon, ang pinag-uusapan itong Omicron. So meron din aside from nagpa-booster na, sila ay nagpa-anti-flu shot at saka nagpa-anti-pneumonia pa.
Correct. Hindi. The anti-flu and anti-pneumonia is needed.
Needed.
It's needed. But you have to be 1 month after. 1 month before vaccine, 1 month after vaccine. But do not do that kasi sobrang overwhelm yung body mo. Because if anti-flu and anti-pneumonia, you can give it at the same time. Your body has to work to produce antibody. But suppose Tapos wala pang isang buwan, wala pa isang, bibirahin mo ng booster. Yung antibody ng katawan mo, hindi na makapag-produce na so overstimulated na. So hindi maganda yung response ng pneumonia at saka flu. Hindi maganda kasi you don't give them time to recover. Parang yung soldier ba? Kakatapos ng gera sa Iraq, gagerahin mo na naman sa ano. So, pagod na yung mga soldier eh. So, nagkaroon ng fatigue. So, the same thing with our body, the antibody. Because you give anti-flu. Now, those people who were given anti-flu and anti-pneumonia, when they got COVID, they survived better. Kaya, we advise them to be vaccinated. Pero 1 month apart, 1 month after the booster or 1 month after the last vaccine, or vaccine first, then after 1 month, saka sila magpa-COVID shot. Okay? So 1 month, 1 month.
Okay, Jerry.
May tanong po dito, can molnupiravir be a replacement for the vaccine
No, kasi molnupiravir is a medical
medicine?
treatment.
Opo.
Wala kang COVID, hindi ka pwedeng uminom yan. So hindi pwede. It's only for the sickness. So ang ano niyan, prevention is better than cure. So kung magbakuna ka, mapreprevent mo yung infection. It's better than taking molnupiravir when you are sick. And you know that COVID, even if you survive, ang dami ng side effect. So cause fibrosis, the most serious complication is sudden heart attack because it causes clotting of the heart, so cause heart attack, clotting of the brain cause stroke. So you will hear, ito, nakaka-discharge lang after 1 week, namatay sa bahay of heart attack. Kaka-discharge lang after 1 week, naka-stroke. So these are the people who have the sequelae or called the long COVID. And they should not have this when they are vaccinated. They have this complication when they are vaccinated. Their recovery will be faster. The infection will be milder. So yun lang.
Okay, next question.
Ang may tanong dito, pag nagpa-booster shot na sila ng Pfizer, after 6 months, pwede pa ba sila mag-Sinovac ulit? I mean, for the regular shot. So after 6 months, pwede bang mag-Sinovac ulit?
Okay, good question. As I said, when you have first, second dose, these are the primer. Pag nag-booster ka, it increased by the 1,000-fold. So for me, before my first shot or fourth shot, I will have my antibody test, neutralizing. You have to specify neutralizing antibody. These are not the IgG, IgM. No, hindi yan. These are the neutralizing antibody. This detect the effectivity of the vaccine. Okay? Pag neutralizing antibody siya, pag mababa na yung antibody niya, go ahead. Pag mataas na, by the thousands,
Hindi muna.
hindi practical. Okay?
Opo.
Okay.
Pero, I mean, kung nag-Pfizer dati, maaari pa ba mag-Sinovac ulit? Pwede naman po. The brand doesn't matter naman po.
Actually, ginawa nga nito ng ginawa to ng Chilean study. They use Astra, then Pfizer. No?
Opo.
So, pwede nga yung mix and match, pwede na.
Alright.
No problem. As I said, when Moderna and then the Pfizer and the Astra, pag may history ng hypersensitivity, may allergy ka, hindi maganda ang reaction. Okay? So, mas maganda mag-Sinovac ka. Pero kung wala ka nang nararamdaman, wala kang allergy, the first 2 doses mo, let's say, first 2 doses mo sa Pfizer, nagkaroon ka allergy, then you go for Sinovac. Okay? Pero kung history, dati ka na nag-allergy, then you go for Sinovac. Kasi nga, so far, ngayon, about studies din sa Chile of 2.5 million, none of them died of vaccine. Ibig sabihin, whether anong binigay mong booster, walang namamatay sa vaccine. Unlike the first 2 doses, meron nagkakaroon ng side effect. The booster did not show any side effect sa any brand. Okay?
Doktor, ito based no sa 'di ba ang daily report ng DOH regarding sa how many pa ang mga positive cases. And then ang isang napapansin ko doktor, bakit like today, halos 50% ng result ay yung mga namatay? Bakit ang mataas pa rin ang yung mga cases ng mga namamatay compared kasi 'di ba kung i-compare natin yung how many na lang ang mga nagpa-positive?
Yes, yes. Good question. Bakit maraming namamatay?
Yes.
Very low.
Mm.
At the patient's profile,
Mm.
90% of them who were in ICU are non-vaccinated.
Oo.
Okay, ngayon, kung nag-vaccinate siya, 10% lang siya ang chance niya ma-ICU.
Mm.
Okay? Ngayon, bakit ang mga ibang tao na-ICU? Bakit yung iba hindi na-ICU? So, dito yung sagot. No? Ito, kita mo ba ito? So, vitamin D. No? Okay.
Mm.
So, if you look at the vitamin D, no, low vitamin D level is an independent factor on assessing severe COVID-19.
Mm.
As you see here, if your vitamin D, no, the normal value is at 30.3, no? Okay. So ngayon, pag ang ang vitamin D level mo nasa 22, you will admitted but not in ICU. But if your vitamin D is 14.4 microgram, you will be admitted in ICU. Now, so this was validated by my patient. Lahat ng mga pinadmit ko sa ICU, lahat mabababa ang vitamin D. Now, meron akong advice sa ating mga manunood at nakikinig sa atin. Assess nyo yung vitamin D level ninyo. And if you have very low vitamin D, you take vitamin D supplement because vitamin D will protect you, improve the immune system of the body. They did a study comparing zinc, vitamin C, and vitamin D. Zinc and vitamin C. Zinc and vitamin C. Walang masyadong proof that they help prevent severity. Wala. Okay? So, latest yan is vitamin D. Kaya you have to have high dose. They say, ang vitamin D in the market is only 800 international unit. No? At 14 na nanogram. So if you take 800 nano international, you will not get the necessary level. So I give 5,000 daily so that I can catch up with the patient vitamin D. And those whose vitamin D was very low, after 1 week, I was able to make it 2 times the level. So we have to give high dose vitamin D. Okay? So in the United States, they use 200,000 unit.
Wow.
Pero experimental yun, no? 200,000 IV injectable. But here, the maximum I give is 5,000 to 10,000 until I reach the normal level. Then I reduce to 5,000 and then I give, kung maintenance ko, I give 800. Now, this is very important for those who are treating COVID because it is the single most important factor of my patients who are dying. Those who came in very low, pag na-ICU yan, once na-ICU, ma-intubate, the chance of survival is very low. So, the most important thing, ano magbibigay natin? You give high-dose vitamin D, do the vitamin D3, request for vitamin D3 level. Pag mababa, you start giving them, you protect your family from getting not only COVID, but pneumonia, anything that will lower down the immune system will be covered by your vitamin D. It is the most important preventive factor now. Dati kasi ako, I advise zinc, I advise vitamin C. But as you see, the treatment of COVID is revolving. Yung totoo last March 2020, hindi na totoo ngayon. Kasi nga nagbabago. We learn more. As we learn more, we become wiser. So yan, itong vitamin D, very ano yan. Ito yung ano, no? Ito yung explanation ng vitamin D. you can get this explanation from Hilda. I can give her a copy of this. Okay?
Okay. And then, Doctor, last question. Nagpa-ano daw siya, nagpa-CPAS siya, and then ang kanyang result ay 96.38. So, ito po ba'y masasabi na
Anong cut-off? Anong cut-off? Hindi, anong cut-off niya?
ang
May cut-off siya eh. Anong cut-off?
ang cut-off is 68. 68.
68 lang? Ano?
Oo. Dapat siya, greater than 68 siya is strong positive.
Oh, strong positive. Yung yung weak positive meron?
Ang less than 30.
Less than 30. So the
Yes.
30 is the cut-off. No?
Yes.
So
Oo.
ngayon, yung antibody niya, hindi, not much, hindi ganun kataas.
Ay, di
So
pa kata.
those
Kasi,
who with antibody,
yes, at ito ang
Na-booster
kanyang
na siya?
after the second dose after the second dose.
correct. Kaya pababa na yan. Pababa na
Pababa.
yan.
Mm-hmm.
Yes. So kaya nga, that's why initially, the FDA and the WHO are against booster. Against, but when they saw that after 6 months, lahat ng mga vaccination, bumaba, kahit na Pfizer, kahit na Astra. They said that we first give it to the immunocompromised, give it to the frontliner.
Frontliners.
And after that, senior citizen, and then after that, general public na. So, they are trying to do that. So they realized that yung antibody talaga bumababa. And then the study of China, after 2 doses of Sinovac in Beijing, it went up to 130 times, no? Okay? It's already high. But I tell you, my other patient has 2,000 times. 130 times yung booster, 2,000 times yung sa kanya because he got COVID infection. So yung COVID infection mo, but may Sinovac ka na nag-COVID infection ka, yung COVID infection mo is the booster already. Booster mo na yun. It is 10 times stronger than the booster. Kaya 2,000 times siya eh.
Oo.
Wow.
Mag-booster ka pa. Ano yung booster mo? No?
Doktor, kasi may actually up to now, we still have 125 participants na talagang gising na gising. At may mga
Okay.
tanong pa. Kaya pa ba, Doc?
Sige lang. Go ahead.
Okay, Jerry.
Okay, hold on dito. Okay. May tanong po dito, can we also get our vitamin D from outside sunlight, in addition to vitamin D supplement?
Very good, very good. So you have at least 30 minutes, no? Kaya ang ano mo kasi during the sunbathing, the time for sunbathing is at 6 o'clock to 8 o'clock.
In the morning.
Yes.
Opo,
Kasi
yes.
yung pinaka-ray niya hindi ganun kainit.
Opo.
When the most dangerous, no, is at 11 o'clock to 3 o'clock. Yun kasagsagan ng init, sobrang init.
Opo.
Okay? So if you want to have a sunbathing, that is a natural vitamin D. I will advise you, go for it. Okay? Go for it.
So mga each time mga 30 minutes.
30 minutes,
Okay
yeah.
lang.
If you have 1
Opo.
hour, the best. No?
The best.
Maglagay ka ng kasi, maglagay ka ng shade, no?
Shades.
Okay?
Opo.
Tapos maglagay ka ng lotion.
Suntan lotion.
Yeah, para hindi
Sunblock.
ka kasi the UV light is harmful to the skin. So if you don't place sunblock, we just need the heat, but the ray has a UV light and it can damage your skin. So you use sunblock, then expose yourself, wear eyeglasses because the UV light can damage your retina.
Okay.
Pag sunglass ka para hindi ka maano sa mata.
Opo. So may isang question dito. Ang sinasabi, how long or ano yung time frame after vaccine para magpagawa ng neutralizing antibody? So
Okay.
kunwari kung magpapacheck siya, how long after ng vaccine?
Okay, good question. Okay, if you are looking for your protection, 2 weeks. But if you want to do the repeat booster, after 6 months. Kung gusto mo after, malaman kung kailangan mo pa mag-booster. But kung interesado ka na ano kaya yung antibody ko? So ideally, you take the antibody before vaccination and then after vaccination. So you can compare.
Compare.
Oo, pero kung pwede man kasi you take the antibody and the minimum date is 2 weeks after. 2 weeks after, pinaka-minimum. 1 year, 2 year, 1 month, 2 months, 3 months, no problem.
And then, Doctor, dito, how about a couple na sila ay fully vaccinated but still got infected? One is recovering while the other one is still critical after a month in the hospital. Ano po ang thoughts po para sa kanila?
Can you repeat? Can you repeat?
Kumbaga ang couple ay fully vaccinated. Tapos pareho
Okay.
sila infected. One
Yes.
is recovering while the other one is still in the critical, nasa critical pa rin
Mm-mm.
after a month in the hospital. So ano ang
Elderly
may ano
na.
mo sa inka? Oo.
Elderly. Okay. The answer to that is the comorbid. So anybody with comorbid of high blood, diabetes,
Mm-mm.
okay, lung disease, okay. So anybody na nagkakaroon ng high blood, diabetes, lung disease, and kidney disease, o meron na siyang mga cancer survivor. So these are the people that is vulnerable. So the other couple, walang diabetes, high blood. So yung couple na walang high blood, walang diabetes, these are the people who recover. And then maybe vitamin D level. Siguro yung siguro yung misis na sa garden, nagdidilig ng mga bulaklak, na-expose ng sunlight. So mas mataas ang vitamin D. So yung husband naman palagi na sa loob lang. So hindi na-expose ng vitamin. So mababa ang vitamin D. So if you have a vitamin D level and it's low, and if you correct that, the patient survival will be improved. So, but this is not very, very commonly done, no? But when I start using it, all my ICU patient and all the patient who died, very low ang vitamin D. So, but those who were very light lang, the vitamin D are very, very high or normal, no? So, yun lang. So, vitamin D and comorbid, no? So, these are the most important factors. Yung mga dating may stroke, may heart attack, basta mayroong problema sa heart, yun, delikado yun. May problema sa diabetes, and the diabetes, they go as high as 500, 600 with insulin already. And then when they recover, wala, off insulin. So that means the reaction of the body is very, very high. When you are stressed, the sugar goes up. Kasi you release a lot of stress hormone. Okay?
Okay.
And then ito ang last question sa chat box natin, Doctor. Pwede po
Sige.
ba na ang i-replace can the molnupiravir be a replacement for the vaccine?
No, cannot be. One is for treatment of COVID and it's to be given only for 5 days.
Mm-mm.
One is for protection, longer. We're talking about 6 months, 1 year protection. Molnupiravir is when you are sick. When you are not sick, you don't take molnupiravir. It is monoclonal antibody.
Mm-mm.
It suppresses the COVID. So when you have no COVID, there's no business giving molnupiravir. And then number 2 is very expensive. Balita ko 2,000 nata isang tabletas, something like that.
Mm-mm.
So very expensive. But
And then,
a new drug in you can get it from some other hospital. This is injectable. Is when you have the COVID and they confirm now within 3 days, then you are symptomatic, pero mild, they can give you injection for 6 hours lang. After 6 hours, you go home. Okay? Symptoms disappear like magic. But that costs you about 55,000. 6 hours lang. Sa emergency room lang ginagamit. So this is something that I want Chinese Gen to have. Kasi if that is the case, we don't have to admit patient. Kasi pag injection, this is from the doctor itself, no? The doctor mismo, siya nagka-COVID, tapos punta siya doon, nagpa-inject siya. The next day, he's up and about. Within 1 week, nagtatrabaho na siya. So this is something that is not available to everybody because it's expensive, but this is a very good drug. This is also monoclonal antibody. Parang monopiravir, pero injectable single dose lang. First time, it drip lang sa emergency room, and then let you go.
So, Doktor, anong message mo sa ating mga alumni at the same time po sa ating mga senior citizen na kung sila ay tapos na po ang kanilang first and second dose, so anong in-advise mo na talaga ipagpatuloy pa rin nila kapag may 6 months na tuloy pa rin ang kanilang third dose?
Yeah, for the people who are senior citizen, immunocompromised, these are special group of people. No, you are the most vulnerable. I'm a senior. No, you are the most vulnerable. Vulnerable, ibig sabihin, madali madisgrasya. And you are supposed to be protected. If you are protected, so pag hindi ka naka-infection, hindi mo mahahawa yung mga kasama mo sa bahay. In short, you do this not for yourself, but for the love of your people surrounding you. Kasi sabi, ayaw ko na magpabakuna. Eh, paano kung nagka-COVID ka? Kawawa naman yung pamilya, di ba? So this thing happened to my, maybe one of my workers working for me, the whole family got COVID. No? So, and then the was not vaccinated.
Okay.
Even with my worker did vaccinate, nahawa rin siya. Yun lang, medyo masakit lang. Ang buong pamilya. And then, the father almost died of COVID, but since they have no means of being admitted. So, fortunately, I was able to treat them at home lang. Nakuha sa prayers and medicine. So, but these are, it will reflect how come we still have 250 who died today, no? So yun ang reflection. The reflection is that 90% of these people should not die if they were vaccinated. 90% of these people should not get infection if they are vaccinated. Okay, so yun lang. Very sad, no? Na booster is to improve your chance of survival if you get COVID. And booster is to prevent you from getting COVID so you can save your family from getting COVID. Yun lang. So, but booster is safe. Any brand you want, it is safe. No, just have the booster. And after that, as Joe Biden said, once we have control of this COVID, I expect the economy to go high. So this is correct. And with the 500 level of infected people now, if we will not allow the overseas worker to come home to their home. Okay, for me, my projection is like this. No, it's like in Taiwan. Taiwan, they have the 777. Bago ka pumasok sa Taiwan, bumalik sa Taiwan, 7 days ka magkaroon ng quarantine outside. And then after that, pagdating mo sa Taiwan, they will quarantine you in a hotel for 7 days. And then after the 7 days, you will be quarantined at home for another 7 days. So 7, 7, 7. Overall, 21 days. Those overseas people who came into the Taiwan, that is supposed to be done in the Philippines to prevent us from getting the South African Omicron virus. No, so that is no. How do you tell the people na overseas worker na dumating sa Pilipinas gusto makita pamilya? How do you tell them not to see the family? Solution is we have the Clark na Athletes Village. Ang laki nun. each family will be given 1 pavilion. O doon lang kayo, pamilya kayo, maghawaan kayo, kayo lang yun. And then after that, pag umalis na yung overseas worker, yung mga kamag-anak niya, ite-testing. So if ever they got infected, they will only isolated. Doon lang sila. Kasi gusto nila makita pamilya nila. But these people has to be quarantined there. That is the only solution to stop this. If you are so, kakahiya naman, overseas worker natin, hindi natin sila mapabayaan na. How about the people who will get the Omicron because of them? No? So this is the same thing was the Delta virus got here because of the overseas traveling. Yun lang, yun lang. So dapat meron tayong projection na gano'n. Those overseas worker na gustong umuwi, okay, sige lang, doon lang kayo, mabilit kayo, bigyan ko kayo ng 1 pavilion. So yun lang. So that will prevent it from spreading. Kung mag-infect sila, whole family lang nila. Kasi gusto nila makita yung parents nila, gusto makita na yung mother nila. But not at the expense of the people like us. Nahawa tayo sa kanila dahil gusto lang nila umuwi. Kawawa naman tayo.
Okay.
Ano,
So maraming salamat po, Dr. Josetan. So
yes.
Here's a certificate of appreciation for Dr. Josetan. So this certificate is awarded to Dr. Jose A. Tan for sharing valuable insights during the St. Stephen's High School Alumni Association Holiday Season Healthy Lifestyle Webinar held on the 4th of December 2021. Signed, Anita Causi, SSHSAA President. Maraming salamat po, Dr. Josetan.
Welcome, welcome. Okay.
Doc Hilda?
At yes po, at nais kong pasalamatan lahat ng ating mga participant. Actually, ang dami pa, more than 100 pa. Talagang gising na gising kasi ang explanation kasi ni Dr. Tan ay talagang very clear. At thank you, Tata, itong ating itong December, itong webinar for this year, ito ang last for this year. Pero next year, hopefully, meron naman tayong mga panibago at very informative. At kung sakali naman, kung pero pa rin kayong mga katanungan, pwede naman kayo mag-message sa akin and then I can ask Dr. Josetan kung meron pa rin kayong mga problem. And then thank you so much po sa lahat po ng mga nag-join at talagang nag-stay up to almost 11 o'clock p.m. Thank you po for joining and hopefully sana marami po kayo napulot na dito sa explanation ni Dr. Josetan. At sa mga hindi pa po nagpapabaksin, kapag may 6 months, ang sa LGU talagang kailangan nila ng 6 months talaga. Let's say, based on your second dose. So let's say, kunwari ang yung second dose ay June 11, December 11, pwede na po kayo booster shot. Yan po ang requirement po ng DOH. Thank you po, Dr. Josetan, for your time.
Yes. Anytime. Okay.
Thank you po.
Okay. Welcome.
Thank you po. Thank you for joining and hopefully see you again for our next webinar.
All right, everyone. Have a wonderful evening. Keep safe and take care.
Thank you at talagang hindi talaga inaantok lahat Nandyan pa rin And
Matibay.
matibay. Meron pa ba kayong question?
Si Dr. Hilda naman ang sasagot.
At yes po, at thank you so much. And then regarding po sa bilang po sa chairperson po ng ating welfare committee, nais ko rin pasalamatan ng ating, syempre sa ating St. Stephen High School alumni. Lahat po very supportive po. Kaya this year, 2000, kahit na nasa pandemic pa rin tayo, ang ating school, ang ating alumni, ay tuloy-tuloy pa rin po ang pagbibigay ng mga tamang impormasyon, which is ako yun, Agaran Spiritual Lady. Yan ang aking tagline. Tamang impormasyon, tamang serbisyo, and then talaga marami tayong natutulungan. At dahil po sa ating alumni, talagang masasabi ko na I'm in the right, kumbaga I am the right group. Kasi ay alam po ng ating principal na si Judy Tan na ako po ay talagang opposite. Talaga ako ay tahimik before. Hindi ko akalain na napunta ako dito. And then, which is, I hope na marami tayong na kumbaga maraming tayong maraming matutulungan. And then ang isa pa, yung ginagawa po natin yung ating pagbibigay po ng mga yung itong mga ating relief goods, 'di ba? Na hindi lang community, at the same time at meron yung mga nagdo-donate ng blood. Alam po ninyo ang dito po sa atin ang Chinese General Hospital and Medical Center. So far po ang dami na po ang mga admitted na hindi COVID ha. Ang pinag-uusapan natin yung mga cancer patients, yung mga may cancer patients, yung mga may bypass, yung mga emergency operation like katulad po ni ating late Ma'am Yuson, yung pagpasok niya sa ospital na kailangan talaga nag-transfuse ng blood. Because of effort po ng St. Stephen High School alumni, we're able to save many lives because of do sa mga ginawa natin sa mga donation, sa mga relief goods at marami tayong mga blood donor. So, hindi natin alam na sino-sino ng mga natutulungan natin. Pero deep inside talagang masaya tayo dahil iba talaga ang joy kapag we share our blessing from God. Kasi syempre, di ba, tayo nabigyan ng magandang, lagi natin sinasabi, maganda ang ating health, maganda ang ating kalusugan, mas maganda na we keep busy helping other people rather than busy with your family na yung pamilya mo ay nagkasakit. So yun po, yun ang kapalit na dapat nating gawin. We give tamang education, tamang pagtuturo, tamang pagkatulong. And then alam po ninyo ang sa akin based on my experience for being a public service lady, ang nakikita ko kapag ako ay tumulong, mas maraming pang blessing na dumarating at ang daming like now. Ako ay mayaman sa kaibigan, hindi ako mayaman sa pera. Mayaman ako sa kaibigan, kaya kapag kami nangangailangan, isang tawag ko lang at nandyan na lahat na willing to help. Yan nga po, kaya ako po din po ay nasa Radio Veritas, which is Caritas in Action. Maraming mga lumalapit at ako rin po ay nagpapasalamat sa lahat din po mga tumutulong. Hopefully tuloy-tuloy pa rin ang St. Stephen High School alumni. And then by next year, January, meron tayo, Jerry, di ba, itong ating Chinese New Year.
Opo, yes.
Naman sa Chinese, ating Chinese culture, Chinese history, yan po. Yan, ganun ang mga. And then, marami pa rin tayong mga health issue. Hopefully, kapag talagang COVID-free na tayo, makakaroon tayo ng medical and surgical mission. At ito ay kausap ko na po si Dr. Robert C. na willing to help our alumni para mas marami pa tayong magagawang project. Ito ay tulong-tulong tayong lahat. And then ngayon, healthy lifestyle tayo ha, at marami na naman mga kainan. Ingat tayo. Kanina, pagka pinakinggan mo si Dr. C, si Dr. Josetan, parang kulang na lang sabi ni Dr. wag na tayo kumain.
Oh, hina-hinay lang po.
Di ba?
Oo.
Kaya po, yan po, ilan pa ba nandito sa atin? Yan, nasa 58 na lang.
88.
Kaya bye
Natulog
po.
na ibang
Matulog
Okay.
na tayo. And then see you again sa ating next meeting.
Sa webinar.
Bye-bye.
Opo, sige. Take care everyone.
Take
Good
care
night.
po.
Thank you
Good
so much.
night.
Thank you. Good night.